You know when you're tired, the small things become big things. My name is Heath. I'm 56 years old, and I'm from Florida. I have excessive daytime sleepiness due to obstructive sleep apnea, and I'm here to tell my SUNOSI story. Having EDS has really affected my work. I've been a lawyer for almost 30 years, and my job requires me to troubleshoot, to solve problems, to be very sharp. And the excessive daytime sleepiness really caused a problem. And I found myself having to take a lot of notes just to keep up. The tiredness just wasn't going away. I was sleeping a lot, not really feeling rested after all the sleep. So I went to a sleep doctor and did a sleep study, and I was diagnosed with obstructive sleep apnea. After the OSA diagnosis, my doctor prescribed a CPAP machine, which really helped with the snoring, but I was still feeling really sleepy during the day. My doctor recommended other medications, but they weren't working well for me, and I experienced side effects. So I decided to finally do something about it and try a different solution. I talked to my doctor about other treatment options, and they suggested that I try SUNOSI. My doctor told me about some of the most common side effects, including headaches and nausea. Since taking SUNOSI along with my CPAP machine, I feel more awake during the day, and I feel more present for my family. I'm also able to be more awake when I'm at work, and I feel like my team can count on me more now. Now that I feel better, I'm more pleasant to be around. From my experience, the one thing I would say to people who are suffering from EDS due to OSA is talk to your doctor about your options. It could redefine what awake means to you. Don't settle for feeling sleepy during the day.
Indication and important safety information. What is SUNOSI? SUNOSI, solriamfetol, is a prescription medicine used to improve wakefulness in adults with excessive daytime sleepiness due to narcolepsy or obstructive sleep apnea, OSA. SUNOSI does not treat the underlying cause of OSA, and SUNOSI does not take the place of any device prescribed for OSA, such as a continuous positive airway pressure CPAP machine. It is important that you continue to use these treatments as prescribed by your healthcare provider. Important safety information. Do not take SUNOSI if you are taking or have stopped taking within the past 14 days a medicine used to treat depression called a monoamine oxidase inhibitor, MAOI. Before taking SUNOSI, tell your doctor about all of your medical conditions, including if you have heart problems, high blood pressure, kidney problems, diabetes, or high cholesterol, have had a heart attack or a stroke, have a history of mental health problems, including psychosis and bipolar disorders, or of drug or alcohol abuse or addiction, are pregnant or planning to become pregnant. It is not known if SUNOSI will harm your unborn baby, are breastfeeding or plan to breastfeed. SUNOSI passes into your breast milk. Talk to your doctor about the best way to feed your baby if you take SUNOSI. What are the possible side effects of SUNOSI? SUNOSI may cause serious side effects, including increased blood pressure and heart rate. SUNOSI can cause blood pressure and heart rate increases that can increase the risk of heart attack, stroke, heart failure, and death. Your doctor should check your blood pressure before and during treatment with SUNOSI. Your doctor may decrease your dose or tell you to stop taking SUNOSI if you develop high blood pressure that does not go away during treatment with SUNOSI. Mental, psychiatric symptoms, including anxiety, problem sleeping, insomnia, irritability, and agitation. Tell your doctor if you develop any of these symptoms. Your doctor may change your dose or tell you to stop taking SUNOSI if you develop side effects during treatment with SUNOSI. The most common side effects of SUNOSI include headache, decreased appetite, problems sleeping, nausea, anxiety. These are not all the possible side effects of SUNOSI. Call your doctor for advice about side effects. SUNOSI, solriamfetol, is available in 75 milligram and 150 milligram tablets and is a federally controlled substance, CIV, because it contains solriamfetol that can be a target for people who abuse prescription medicines or street drugs. Keep SUNOSI in a safe place to protect it from theft. Never give or sell your SUNOSI to anyone else because it may cause death or harm them, and it is against the law. Tell your doctor if you have ever abused or been dependent on alcohol, prescription medicines, or street drugs. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. Please see full prescribing information and medication guide on sunosi.com.